Raquel Martin has raised her family and gone on to develop a career writing about healthcare alternatives. Her research took a new direction when she began experiencing symptoms of menopause.
When I got into the throes of menopause, that's when things really, I knew there was a missing link because nothing was helping me. So I zeroed into doing different research, and fortunately I came across a medical doctor's newsletter that talked about progesterone. And it was just remarkable. It was like a revelation to hear that raising your progesterone levels will help with ward off osteoporosis, fibromyalgia, fibroids, endometriosis, a long list, everything from PMS to menopause. And what was really fascinating was that when it comes to cancer, progesterone, adding the progesterone, opposes estrogen stimulatory effect on cell growth. Well, when I heard this, I thought, this is the missing link.
Dr. Judy Gerstun works as a radiologist at Life University, a well-known chiropractic school in Marietta, Georgia. As a radiologist and a chiropractor, she was deeply disturbed by a pattern she was seeing in x-rays and with her patients.
Osteoporosis is a condition of demineralization of the spine. And so as a radiologist here, I was looking at many x-rays, and it was just coming up more often than I expected.
She became an avid student of osteoporosis, hoping to find a reason for this trend.
I was quite taken aback that bone density was related to some kind of hormone balance. And I really had never, ever in my entire life thought about that. And I'm still surprised. I just don't understand why bone density had to be related to hormones, but guess what? It is. So we have to live with that. The cause of osteoporosis from a hormonal level is an imbalance in the amount of bone buildup versus bone breakdown, which is something that's going on in all of our skeletons all the time. We have bone cells that contribute to building up bone, and then other ones that break down the old bone. So it's really a living, viable organism there that's going on, and there's an interaction back and forth. When we have more bone breakdown than we have bone buildup, the skeleton becomes osteoporotic. The standard approach, and for many of us, we still think the only approach, is synthetic hormone replacement therapy as we know it. And that may do something to slow bone loss, but it isn't actively building good new bone, and it certainly isn't without risk.
Estrogen is known to slow down bone loss, but it doesn't build bone mass. On the other hand, natural progesterone actually stimulates cells in the bones, triggering bone growth. And it does this naturally.
But it will actually help the use of natural progesterone in preventing and reversing osteoporosis comes to us from clinical and case studies of women who had DEXA tests before they started using the progesterone, and then follow-up tests over a period of 1, 2, 3, 4 years. And they found that even 70-year-old women with, let's say, 1 or 2 compression fractures, which would be a sign of frank osteoporosis, did have anywhere from 10, 15, even 25% increase in new bone density. That's almost unheard of. In this case, they're not just slowing down the loss of the old bone, but we're actually creating new, stronger bone. It doesn't bring back bone height, but it actually keeps the bone from losing more height. If you can take a skeleton that's losing bone and you can put in new bone, then you're really changing things.
But what continued to puzzle Dr. Gerstun is why a disease usually found in postmenopausal women was showing up in younger and younger women. She found a possible explanation when she helped Raquel Martin research and write a book on natural progesterone.
2 years ago when we were finalizing the book,
The Estrogen Alternative is a compilation of studies and observations on the role of progesterone in women's health. It also explores why women are increasingly faced with hormone imbalance at an earlier age. The co-authors concluded, along with others, that the increased presence of estrogens in our environment is being absorbed by our bodies.
there are many estrogens in the environment, and they're known as xenoestrogens. And we found out that the molecules in plastics, the molecules in the pesticides, the molecules in these growth hormones have an estrogenic nature to them. And when we take them into our body, the body interprets them as estrogen. They attach to our estrogen receptors, and they actually turn on the genes in the cell that cause cancer formation, tumor formation, and overgrowth. It turns out that progesterone is the counter to that. Progesterone will actually stop and counter excessive cell growth.
The road to discovery opened these co-authors' eyes to the importance of progesterone in balancing an overabundant supply of estrogen. While they advocate natural progesterone as an answer for hormonal imbalance, they encourage women to listen to their bodies and educate themselves.
I learn from, well, education or desperation. And I learn from desperation, whereas I'm hoping more women will learn from education. My favorite chapter to write was the last chapter. And the reason I like to write it, because I didn't have to document all my thoughts with double-blind studies and clinical abstracts, but instead I just dredged up past memories of my own vulnerable state of needing help. And that's what many women are going through. They're vulnerable, and they're taking their estrogen synthetic hormone replacement. But the memory of this experience was actually the fuel that helped me to write for women how to be armed and confident and assertive when taking the research that we have found, over 250 references there. Take that into your doctor's office that explains the need for safe botanical progesterone.